All right, now, going to the telephone line, we've got Robert Harriman. Robert is from Outback News Today. Hey, Robert, how you doing?
Hey, Captain, that's outbreaknewstoday.com.
Okay, Outbreak News Today. What did I just say?
Outback.
Oh, okay, well, so I can't read my own writing.
Not a problem.
Jeez, God. All right, and of course, you are very good at what you do, and you talk about a lot of things regarding communicable diseases and whatnot. And you and I were talking about a week or so ago, maybe 10 days ago, about what's going on in Venezuela, because Venezuela has lost complete control of their health system. I mean, diseases that are running rampant in there now are things that we haven't seen in some cases for 100 years.
Yeah, the situation is getting really bad. Of course, the political and economic situation in Venezuela really perpetuated all this. I mean, if you look at the inflation rate there, I mean, in 2018, it ended at 1.3 million %. And experts are saying that it's going to hit 10 million %. Imagine that 10 million % inflation by the end of this year. But anyway, so we have this massive extreme poverty, which has led to a total collapse of the healthcare infrastructure, which has really led to the resurgence of a lot of diseases, particularly the three most common ones that we hear about. And I've been covering this for years now, long before many in the media were, was measles, diphtheria, and incredible amounts of malaria. I mean, just astronomical. Yeah. And a lot of this is due to, the economic situation, because we have lots of job losses down there, several years ago, and you saw this dismantling of the private industry, which resulted in a lot of people going nomadic, looking for illegal work, basically. And a lot of people ended up in illegal gold mines and stuff like that. And you have this influx of population, this overcrowding, which really led to these outbreaks that we're seeing now. For example, measles was eliminated from Venezuela in 2007, and today we've seen several thousand cases that have resurged. The immunization program in Venezuela essentially halted about 2010, and there's just, I mean, the immunization rates down there are below 50% now. It's just a horrific situation. And cases of diphtheria, too, which is another vaccine-preventable disease, which is really, really more serious, because they're seeing about 2 out of every 10 people that get diphtheria down there die. It's about a 20% death rate. So it's really, really serious.
Yeah, and it's going to get worse because Maduro, the leader, current leader, who's being challenged by Guaido, this other guy, who apparently, per the Constitution, became the leader. But anyway, Maduro was not letting anything in from the outside, and that includes medical supplies.
Yeah, and hopefully he changes his mind on that. But right now, I mean, the public health infrastructure doesn't have any vaccines. So essentially, if you want vaccines down there, you can get it on the black market, the private market, but that's going to be an international currency, most likely dollars. And people down there are living on $2 a month. I mean, it's just not going to happen. Nobody can really afford it. So, yeah.
And how are we going to grab a hold of this? I mean, the United Nations wants to declare a humanitarian health emergency, but if Maduro's not going to let the people in, what good's that going to do?
Well, it's not going to do any good. So, I mean, that's what's going to have to happen. Either, something has to change with the political structure there, or Maduro's going to have to start letting in outside health agencies to help out with this. And other than that, it's going to spiral out of control. And it's not only spiraling out of control in Venezuela proper, but all their neighbors are being affected by this. For example, Brazil last year saw 10,000 measles cases. Primarily, all of them were from Venezuela. And of course, Colombia and Ecuador and a lot of these other countries are seeing it. And the malaria situation, which is something we don't hear a whole lot about. Malaria I started reporting spikes in malaria in about 2015. We started seeing over 100,000 cases. Well, that's a lot for the Western Hemisphere. Holy cow. Well, last year, NGOs on the ground that are doing forensic epidemiology in Venezuela, going from village to village to village to village, reported 1.3 million malaria cases in Venezuela. That rivals anything in Africa.
My goodness.
Yeah, it's just thoroughly out of control.
And then these people start wandering up through the system. God forbid they come towards the United States, and boom, we've got them.
Well, I mean, that's a possibility. Most of them cannot afford to, though, so that's the one thing. And the people that have already left, and this is another unfortunate thing with the healthcare crisis, is in 2014, about 1/3 of all the doctors and everything, they bailed. They bailed the country. They went to Spain. They went to the United States. They went to Colombia. They just left. So you have no healthcare personnel down there either. So it's a really, really rough situation down there. So, yeah.
So what's the answer? What's the answer? Is it the United Nations? Is it? Well, I hate to say this, but would it be military action to get the health people in there?
Well, I mean, the immediate answer, the long-term situation is a brand new government, right? That's all got to be, every time you see a totalitarian state, don't be surprised if you see all these epidemics and outbreaks, because this is what happens. This is the outcome of totalitarian states. The immediate action, I believe, would just be the UN. This is the perfect role for the UN, is to getting vaccinators in there and medicines, right? I mean, 9 out of 10 hospitals in Venezuela don't have like any medicine. I mean, it's just a horrific situation. And, and they're also dealing with blackouts constantly.
Right.
No water. So here you have, Captain, you have people with no water. When the water does come on, what do you think they do? They hoard it. So they fill up containers, and that creates mosquito breeding grounds for other things like dengue fever.
And they're also going down into the sewer to get water, which is not good, which also will bring up more diseases.
Yeah. I mean, and there's other things that are popping up there now too. Of course, dengue fever is increasing. I've read that leprosy is starting to increase, Chagas disease. So there's a lot of really bad stuff going on down there, and it's going to affect especially their closest neighbors, Brazil and Colombia.
All right, now I'm coming to the end of the segment, and we got about 30 seconds here. So I want to make sure that you give them, we give you a chance to tell everybody about your website, how to go there, find out about yourself, find out about all the different things that you do on that website. Plus, they also can find a link to your radio show over there too, right?
Sure. I'm the editor-in-chief of a website called outbreaknewstoday.com that's been up since about 2014. And so we're going on over 5 years. I also have a podcast that's found on Apple and Stitcher. It's called Outbreak News Interviews. And, of course, I do the radio show, which can be found there also.
All right. Thank you, Robert.
All right, Captain. Thanks a lot.
Yep. Harriman, everybody.